So my name is Ellie Wiley. I'm a health visitor, but I've come to talk about public health nursing today. So for a background, all health visitors and school nurses are qualified registered nurses, and we're regulated by the Nursing and Midwifery Council. So the majority of people that come into the service have a background in midwifery, child health, paediatric nursing, adult general nursing, or mental health or learning disability. So to become a public health nurse, you will complete a 52-week programme, which is now at a master's level, and our current university provider is UWE, which is the west of England. So our school nurses are made up of school nurses, community staff nurses and assistant practitioners, and the health visiting team are made up of qualified health visitors, community staff nurses and our assistant practitioners. So our public health nursing role is commissioned by Somerset Council, and we work as health visitors under the specialist community public health nurse standards of proficiency. So we have 4 domains that we work under. The first is stimulating an awareness of health needs, and I'll explain these in later slides. The next one is that we search for health needs. The third one is that we influence policies affecting health. And lastly, we facilitate health enhancing activities. We offer all families the Healthy Child programme, and what that does is it aims to bring together health education and other partners to deliver an effective programme for prevention and support. The Healthy Child programme is an evidence-based universal programme for children aged 0 to 19, and it is the bedrock for health improvement. So health visitors and school nurses provide 4 levels of service. We have our community-based work, our universal work, our targeted and our specialist. So every single family in England, when they become pregnant, is offered the universal health visiting service. And within that, there are 5 mandated contacts. And the first one is an antenatal, where we're liaising with the midwifery service, doctors, and anybody who has information on this family to ensure that the lady is having a safe pregnancy and that there are no concerns. When the baby is born, we go back to the family and provide the family with a primary birth visit. And throughout this, we are ensuring that the voice of the child is heard, that we're working in partnership with the family, and more importantly, we're just a transparent service to that family. If at any point we feel that family need a targeted piece of work, we will decide within the team who is the best person to provide that for the family. And a targeted piece of work could be anything from a feeding problem, we could have sleep problems, there could be behaviour problems, and we refer on to other agencies. We are very lucky in Somerset. We've recently had 2 services commissioned. The first one is our infant feeding nurse, who is Amber Austin, who we refer to a lot for an infant feeding problem. And our other service is our mental health support with Jenny Candler. Our last service that we offer is a specialist role. I'm going to move on to the next slide. So our specialist service is where we're working with complex families with complex problems and safeguarding, and we are trying very hard to improve outcomes for children, to improve school readiness. I mentioned earlier about working with other services, and I think the midwifery service was talking about the safeguarding. Um, our role is about thinking about the family, but focusing on the voice of the child, and ensuring that everybody in that family is involved in the child's health. And we try very hard to include fathers in our home visits. Sometimes it's very difficult because our service is 9 to 5, and sometimes we have to offer things to people earlier in the morning or later in the evening. We also have a service called Chat Health, which I will put the numbers in the chat later, but we have three levels of Chat Health. We have our 0 to 5 service for parents of children 0 to 5. We have a parents 5 to 19 service, but we also have a child Chat Health for 11 to 19-year-olds that can phone in. The school nursing service, although I'm not a school nurse, offer a 5 to 19 programme, and they complete their child health needs assessments. They also have the National Child Measurement Programme, which they're commissioned to deliver. Again, their role is about thinking about the voice of the child and ensuring that the voice of the child comes through in their assessments. The school nurses service also offers a continence role for primary enuresis. They offer the C card for contraception, and they link very closely with education and health. So as I said earlier, the focus of our public health nursing is on prevention, health promotion for children, young people and families. And this is where we have our knowledge and skill, and it can have the greatest impact. As public health nurses, we know that our community support is there to signpost children, young people to the right service at the right time. And we also have a range of information advice that we promote through our social media sites.